Good afternoon. We are very pleased to welcome you to the fourth HHS Capacity Building Training of 2023. And if you have attended these previously, you know that as part of the Evidence Act, HHS and other agencies did capacity assessments to determine the capacity of our agency to build strong, sound, usable evidence. Based on that capacity assessment, we saw some areas where training would be helpful to HHS, and based on that, we developed this training series. This session in particular will help you to understand how policy developments can affect data definitions, availability, and quality. During this session, we'll start with an overview of ways that policy may affect data directly and indirectly, provide examples of types of data challenges that you might face as a result of how a policy is designed, and strategies to help you cope with those challenges. There will be time for questions at the end, but please submit questions using the Q&A feature throughout the session, and you can also use the chat feature if you want to. By way of housekeeping, before I introduce today's speaker, I just want to cover a couple of things. Today's webinar is being recorded, and a link to the recording will be made available once it is set and done, and we have the captions inserted and everything else. So we will be putting the slides, the recording in the HHS Strategic Planning Resource Center, and we will send that around to folks. We have the other previous trainings, the 5 from last year and the 3 that we've had so far this year, up in the Strategic Planning Resource Center. And again, please submit your questions throughout the presentation through the Q&A feature or through the chat, and we should have some time at the end for questions. So now I would like to introduce Dr. Rupa Datta, our speaker for today. And Dr. Datta is a distinguished senior fellow in the Methodology and Quantitative Social Sciences Department at NORC at the University of Chicago, and is a lecturer in the Harris School of Graduate Public Policy Studies at the University of Chicago. We're very happy to have her here. Her 2 major areas of expertise are in understanding the role of education and other social institutions in improving the well-being of individuals and communities, and improving research methods available to advance that understanding. She's led major efforts in human capital research for over 25 years, focusing on multi-method, multi-mode, complex research designs, which you know we love very much. And she has done a lot of work on disciplinary approaches and analytic methods to answer the pressing questions about education, employment, and their interconnections. And her methodological focus has been on the measurement of an improvement of data quality in surveys and administrative and commercial data. So I think it's really a treat to have her here with us today. And Rupa, I turn it over to you for your presentation. Thank you so much for joining us.
Great. Thank you for having me, and thanks to everyone for joining today. I'm going to talk about how data policy decisions affect evidence building, with particular focus on implications of how policy decisions affect our ability to evaluate. Just to give you a high level, Susan mentioned as well, we'll do a little bit of introduction. I'll give away some of my main point, which is that variation in policy implementation can be a major type of policy decision that affects how we can evaluate the policy. So I'll spend a little bit of time talking about how we see variation in policy implementation. Then we'll spend the bulk of our time on common types of data availability challenges. What are some of the things that we deal with when we have policies that vary in their implementation? And so that we can all leave hopeful. After we've reviewed some of the challenges, I'll talk a little bit about some of the evaluation strategies we use to cope with those challenges. Susan gave a lengthy introduction of my work. I'll just say that mostly what I'm talking about today is there isn't a clear theoretical foundation. I'm not presenting a well-developed model. What I am doing is sharing observations that have come to me over decades of building data sets for policy evaluation. A lot of the work that I do is to build data sets that will be public use data sets for the research community to do whatever they want with. And so I'm in the business of trying to understand what people might want to do with the data, particularly in terms of policy evaluation, and what might be possible to include in data sets, whether they're survey data, administrative data, some other kind of data, so that an unknown researcher with an unknown research question might be able to productively use the data for policy evaluation. And so that's really the lens that I come with. What are the types of data that we could build into our data sets so that they will be useful for evaluation in the future? A lot of the work I've done is in two major areas. One of them is labor force. I spent 25 years on the National Longitudinal Surveys of Youth, which is a data set dealing with labor force participation, and particularly how everything else in life, education, family formation, immigration, criminal justice, affects employment and is affected by it. And then the other work that I've done a lot is having to do with childcare. The National Survey of Early Care and Education is a study of childcare providers and households with young children. And again, there are many different policy touch points in those in that childcare setting. So those are two topical areas where I've particularly thought about these questions of the types of policies that have different implications for evaluation. To begin with, some policies directly affect data availability. That's their purpose. The Evidence-Based Policy Act, for example, it intends to increase the availability and the quality of data. Another kind of policy that affects data availability might be, for example, during COVID, the Office of Head Start waived some of the reporting requirements of its grantees. They were undergoing a very stressful time, and to alleviate some stress and burden, grantees did not have to submit one of their required reports. What that means is that in the future, when we have time series and would like to do analyses, we will be missing a year of data, and of course, a particularly important year, since that was the 1920 grant year, was of course the one with the most significant lockdowns. So those are policies that directly affect data availability. That was their point. Often, policies indirectly affect data availability. Nobody was really thinking about the data when they made the decision, but the net result is that there is a change in the available data. One example comes again from COVID. My children were in public schools in Illinois during the early years of COVID. Illinois made free lunch available to all public school students. What that means is that one of the most common indicators of socioeconomic status that education researchers use, which is the free lunch eligibility, was not collected because everyone in the state was eligible for a free lunch. So a very important covariate that education researchers use was not collected that year, will not be available in time series. That was not, data availability was not the first, second, or 17th intention of making free lunch universally available, but it is a clear indirect consequence of the policy change. Similarly, the Tax Cuts and Jobs Act of 2017 raised the standard deduction in the federal income tax policy, which means that many households stopped itemizing deductions. That means that they stopped providing the details for what they would have itemized. If you think about what the data will look like, there will still be itemizations, but a non-random subset of households will no longer be itemizing. And so when we think about what we could do with income tax data, we need to anticipate that in conjunction with this legislation, there was a change in the type of data that would be available, and inferences could change simply because of this indirect impact. So I'd be curious whether there are other examples that come to mind of policies that affect data availability, either directly or indirectly. And Susan, I think you may have had an example or two.
Yes. So one example that I know of from a program that I worked in when I was in one of the operating divisions in HHS was a policy that allowed the grantees to really determine how they were going to implement the program. And that made it very difficult to compare one program to another program, even though we might be collecting the same data from each of those programs and the data were standardized and coordinated, the programs were actually different. So then the data in that sense were different because of the way the program, the policy was defined.
I don't know if folks in the wanted to drop anything else in the chat, similar examples. Susan set us up for the very common. I'm going to continue, I think, and if people add examples of other data availability, we can come back to them later in the conversation. So certainly there are policies that directly or indirectly affect data availability. What I'd say happens much more often is that policies reveal data gaps or they reprioritize data gaps, meaning that you never had those data to begin with, but nobody needed them before. And now, because of how a policy has been articulated, now all of a sudden you really want to have those data. And so it's more urgent, or you're noticing that, oh, we never actually measured that thing before, but now we wish to. I'm going to talk about two particular types of data that we might want in the context of policy evaluation. Those are data needed to identify program recipients or data needed to construct comparisons or baselines. Of course, you could need other data to understand the program experience that recipients have, or to understand the impact on recipients of the program. But even just these first two things, who participates in the program and whom might we compare them to, or what's a baseline level, that alone reveals lots of data gaps and is more than enough for us to talk about. I also want to point out that the data that we're looking for might be prospective. You'd like to, in the future, as the policy rolls out, you would like to be able to measure things. In some cases, you might also wish for it retrospectively. You might, for overtime comparisons, wish for historical data. And those are, of course, even harder to come by, since then you really are limited to whatever has already been collected. So we're thinking about policies that, in order to evaluate them, you suddenly are looking for new data and new things to measure. So Susan mentioned variation in policy implementation. I'm going to just take a slight detour and talk a little bit about how we see policy implementation variation. This is a very simple schematic, but just to articulate for us that Congress may pass a law, you get legislation. In many cases, then a federal agency will issue some program guidance. This is how grantees might comply with the law. Then we move to grantees actually implementing that guidance in compliance with the law. A lot of what I talk about today will be at the state level. The state is the grantee, but certainly we can have other grantees. The state may in turn need local service providers to determine eligibility, deliver services, administer programs. So there will be yet another layer of implementation. And then we might have the service recipients, the ordinary people who are actually the recipients of the benefits or the services. And each of these layers has the potential to introduce variation intentionally or unintentionally. I'm going to give a particular example just as an illustration. The Child Care and Development Fund is a funding source that provides childcare subsidies to low-income families and also invests in improving the quality of care that all children may receive. In 2014, the CCDF block grant was reauthorized for the first time in nearly 20 years. And then in 2016, the Office of Child Care here in HHS published a final rule that gave guidance. This is the program guidance. How are states expected to comply with the act and how will they participate? States, territories, and tribes can all be grantees for this legislation. So I'm going to draw a few examples from this particular legislation. To begin with the idea of, well, how much variation can we actually see? The CCDF language requires that employment be a qualifying activity for childcare subsidies in all states and territories. That means that any state's implementation of the block grant must use parental employment to determine whether or not a household receives childcare subsidies. But that's all it says. And so this map shows us that there's quite a bit of variation in how states translate that employment as a qualifying activity. In 29 states, it looks like in the very lightest blue, just as long as parents are working, they are qualifying. Whereas we've got 6 states that set a minimum work hour requirement of between 26 and 30 hours weekly in order to qualify for the childcare subsidy. That in itself is quite a significant variation from 0 to 26 to 30 hours per week across states. I'm drawing this information. This map comes from a policy database that ACF funds and maintains that literally collects how each state and territory and tribe is implementing its CCDF program. So you've got a policy database that does nothing but track the implementation details of this program. As you'll see as I move forward, I think this is one of the keys to dealing with policy implementation variation is tracking closely what the programs are doing. So other than block grants, we may see variations in implementation of federal policy in other ways. I don't know whether there folks might have some examples they want to put into the chat, or if other examples come to mind.
We did have one example related to an executive order, and we've had a series of executive orders related to equity, related to environmental justice, related to other things. And those are, I think, having an impact on the data that are available, the focus on different types of data. A number of the recent executive orders have had sections on data specifically. And while they haven't defined the data elements specifically, they have required that data take these things into account and data focus on these areas. So that's a little bit different than some things we've seen in recent years before this time.
That's a great example. It hadn't occurred to me, but even as you're saying it, I'm recalling many different things that I've seen change in my work. Yes, thank you. Another kind of variation that we sometimes see would be waivers. So a policy is implemented, but states or other grantees may apply for waivers. So although the intention may not be variation, waivers can induce variation. Okay, so we've established that there are many types of policies that can result in implementation variation. And now I'd like to talk a little bit about what we see on the data side when we get that kind of implementation variation. So why do we see data gaps arise? This list is really, I've built it from experience, from talking with others, from my work. It's not a formal framework, and many of you on the call today may have other examples that you'd like to add to it, but I think this is a good representative list of the types of things that can lead to data gaps. I'll run through them here and then we'll talk about each of them a little bit more. So timing issues of various sorts can affect the data you need, the data you have, how you interpret the data you want. So timing issues. Conceptually challenging definitions. Sometimes it can be the case that it's just hard to develop a good measure of something that has been implemented into the policy. Even when the definitions are clear, we have to know all of the variation in grantee implementation in order to be able to study the policy. And there can be challenges to understanding that variation. How are the grantees implementing the various aspects of a policy? If there are multiple categories or components of a program, then even if we quite well understand the implementation, it's still possible to not have full information to understand which components apply to which individuals or which organizations, and therefore we can't fully identify participants, impacts, the rules that they're under. A very common problem that I imagine many of you have dealt with is the level of evaluation design. Are we thinking about a population evaluation? Are we thinking about an evaluation only for the people participating in a program? And of course, there are infinitely many levels in between. We want to think about how does the data availability that we have match with the level of evaluation that we are going to undertake. And then just as a general observation, I think I'll speak personally that I see the movement towards more customer-friendly policies as a wonderful thing. We are recognizing that there is such a thing as administrative burden that makes it difficult for individuals to participate in policies. There can be, conflicting eligibility requirements, conflicting paperwork requirements, all of which has historically made it very difficult for individuals to receive benefits from the programs that are designed for them. I think we're seeing increasingly a move towards customer-friendly policies, but often customer friendly also means harder to evaluate and harder to isolate in data. And we'll talk a little bit about that as a general pattern. So in terms of timing issues, what am I thinking about? Sometimes a policy is not, it's not clear what's going to be in the policy until it's been enacted, and then it's implemented very quickly thereafter, which means that there wasn't enough time to collect a proper baseline. We may have been willing to and interested in collecting a baseline, but if you don't know what's going to be in the policy, you don't know what to measure. In other cases, the policy is enacted, but then the grantees have to take time to articulate what their programs are going to be, how they're going to implement. That timing can vary from grantee to grantee, and that can make it hard for us to know, for example, when was the start of the program? Where does the baseline get measured? And then implementation itself can sometimes have an on-ramp. Maybe the first quarter of a new job training program, not very many people actually enrolled. And so when you're thinking about when to measure your program being in full steam, it can be unclear because you really need to know how the program was implemented, when it was implemented, and when it hit a certain stride. If you have administrative data that are required as part of the program or the policy, there may be reporting requirements which are very helpful, but it can take some time to stabilize for definitions to get clarified. There can be some initial lags in reporting as systems get worked out and figured out, all of which can lead to lags, to unclear timing. My example in this case is that I conducted a survey that included items about perceptions of background checks because the CCDF reauthorization had some requirements for staff to undergo background checks before they could work in childcare settings. So we asked some perception questions, but there were some delays in setting up the interstate background checks. There were some states that were engaged in litigation. So the measure that we had collected as intending to measure perceptions of how the background checks were working for people ended up mostly being collected from people who had not yet been subject to the background checks. So we ended up with a baseline measure rather than a full implementation measure. You wouldn't know that unless you knew when the background checks actually got implemented in any given setting, which is not available in the survey data. Concepts can sometimes be very difficult to measure, in which case either in a survey setting, respondents can't tell you what they're participating in or whether they meet the eligibility criteria or not. And in administrative data, sometimes it can be challenging to gather the data because they have to be drawn from too many places or there are other obstacles to measurement. I'll give another CCDF example. Prior to reauthorization, a household was eligible to receive childcare subsidies if it fell below a certain income threshold, if all parents in the household were working in school or in training, and the subsidy would pay for the hours of childcare when the parent was at work. So if I worked from 10 to 1, then the subsidy would pay for childcare from 10 to 1. So what did you need in terms of data to be able to calculate this? You needed to know household income, you needed to know if the parents were in work, school, or training, and which hours they worked. Those are at least a feasible set of things to collect. Reauthorization brought forward a different mindset where continuity of care for children was prioritized. The old system had a lot of disruptions. It was difficult for children to participate in an ongoing basis in a single childcare setting, which is very important from a child development perspective. But the new legislation says that households need to be below an income threshold at the time of subsidy entry. Then there will be a 12-month redetermination period before which the household does not have to reprove its qualifications. The legislation allows for some fluctuation in earnings, understanding that you may work seasonally or in other ways, so that in any given month, maybe income might exceed a threshold, but the annual rate would still be below the threshold. Parents can receive subsidies while they're looking for work, not just if they're working currently, and until the next redetermination period, which isn't until 12 months from now. So what would even be all of the different data elements you need to be able to measure all of these things? That's conceptually a much more challenging problem, although from the customer service perspective, it is a more supportive situation for the children. Variation in how states are implementing policy is critical to knowing what data you need. But states aren't always in the business of documenting their policy for researchers, right? And so things can change, policies can change, implementation can get tweaked over time. Often the current policy may be available, but what had happened and when it changed may not have been recorded in a formal way, especially now we rely so much on, say, websites getting updated so that the paper trail is less evident. These can generate huge data gap problems for evaluation purposes. Sometimes we can understand the policy, but still lack data elements to connect properly participants or potential participants with the policy components. I'll give an example from the childcare setting. The CCDF reauthorization allows states to pay higher subsidy rates to providers that are judged to be providing higher quality care. In order to evaluate that kind of a premium, you need to know which childcare providers are receiving childcare subsidies. Not all of them do. And then you'd need to know which childcare providers had been deemed by their states to be providing higher quality care. So you need to know the state's designation on quality, you need to know the provider's subsidy receipt status, and then there's a family somewhere whose receipt of the subsidy you're trying to understand. That's a lot of data from different sources that you would need to triangulate to have full information. We've talked about the fact that the level of evaluation design is very important to match with the data availability, so that you might say, okay, I have these data, I think I can address this aspect of the evaluation question, but not other aspects. Some particular challenges can be very small programs at innovative stages or in smaller states. It can be difficult to have enough sample sizes to be able to detect activity in broader populations. Another challenge that happens often is that if the number of participants is too small, your false positives may actually outnumber the true participants. This can happen in survey data. because a plain language question about an apprenticeship program, for example, did you participate in a training program where you were paid for your work and you worked in addition to receiving classroom training? A lot of people would say yes when they're not really in an apprenticeship program. So trying to identify ways to actually measure specific components without dragging in a whole bunch of false positives that seem like they meet the criteria but don't, can be a particular challenge. And then this customer friendliness is such a great trend, but I think we are just grappling with how difficult it can be on an evaluation side. So coordinated intake, when you determine eligibility for SNAP and Medicaid at the same time, debit cards, so that a recipient isn't necessarily aware of the program that's sending them a check every month in an envelope with letterhead like they used to, may make it harder for respondents to report that they participate in a program. Blended funding streams can be really flexible, but they also require disentangling. This is a situation, I'd say, where the policy is headed in the right direction. Again, my personal opinion. It's wonderful to have more customer-friendly policies, but it's on us as a research and evaluation community to figure out how we're going to solve the measurement challenges that come with many of these more customer-friendly approaches to human services. So that's kind of a litany of types of data gaps that can arise from different aspects of policy implementation. I think we'll take time for a poll. Let's see if some of these different types of data gaps are resonating with you, if you're recognizing some of the data gaps that I just enumerated as things that you've experienced. Hopefully a poll has popped up on your screen. These are the different types that we talked through. Timing issues, definitions. Right. So timing issues actually are both very commonly experienced, and the conceptually challenging definitions. And it sounds like the participants not being able to be matched to relevant implementation factors. That can happen less frequently. That makes sense, because I think it requires quite a more complex, multi-layered type of policy to undertake. I see that the customer friendliness has not been as much of an obstacle from what we're seeing in the poll, and that I wonder why that might be, whether it's that there aren't enough customer-friendly policies, or it's maybe we don't always articulate that that's the challenge. I hope that as we get to the question and answer, folks will maybe chime in of some other kinds of data gaps that you've experienced. Thank you for participating in the poll. So to close things out, I feel like this is a doom and gloom presentation. Whatever policy you pass, there are going to be 10 things that make it hard for us to evaluate. So I'd like to close off by thinking a little bit about some of the strategies that we can use to cope with these data gaps. I went to graduate school a few decades ago, where we learned all sorts of tools, imputation, modeling, sophisticated econometrics and statistics was going to resolve any data gap that we encountered. I think my thinking has evolved from that, but certainly there are a variety of tools that can be very valuable in dealing with different kinds of data gaps. Almost at the total other end of the spectrum, I personally can't emphasize enough the value of gathering program implementation details. How did the grantees choose to implement? What were the characteristics of their programs? What were the specific criteria? When did those criteria change? That's really can often be quite qualitative, that kind of data gathering and data understanding. But in these variable implementation settings, I don't think we can overestimate the value of gathering program implementation details. Similarly, because of the complexity, I think linking survey data, administrative data, policy context information is often the best strategy. It's almost never the case that one data set will do everything for us. And so how can we bring together many different sources to address our data needs and provide informative evaluation? Even when there are administrative data, I think many of us may have had the experience of the data not always being of uniformly high quality, or we want to do something with one of the data elements, and the people close, the owners of the data or the people who collected it, will say, oh, no, that's not how we used that field. Or, oh, the intake interview was so long, we would often skip that one. I think enlisting the people who are implementing programs, whether those are service providers, or if the implementation at the state level, say, involves an eligibility form or something, at those levels, communicating with those entities about what the administrative data might eventually do, not just the administrative purpose that it serves, but the potential evaluation purpose it serves, can help us sort of all work together to improve the quality of some of those data from the outset. And then this question of aligning the unit of analysis with what the data can support. It's often the case, I think, that we'll need to use maybe survey data for a population level, a policy impact, but administrative data to really understand the experiences of the program participants, and maybe, different combinations of data between those. And so I often encourage people who want to work with our data sets that you have to assess the quality, and then you refine your evaluation question. And then you dig into the data a little bit more, and you might refine your evaluation question yet again, just to make sure that the data availability and the analysis approach are properly aligned. Neither of these is an absolute. It's a question of fitting the two together. So that's my initial list of how we cope with data gaps, but maybe others will have coping strategies to add to this list, as well as I think we're open to questions and comments about any of the earlier material. So, Susan, I don't know if you're giving the instructions for participants.
Yes. So thank you so much for your presentation. And to those of you that were putting information in the chat, we really appreciate that. We don't have any questions in the Q&A feature. So if people have questions, certainly feel free to do that. We have about 5 or 6 minutes for questions. So absolutely feel free to do that. You can also raise your hand in the Zoom features, and we can unmute people one by one so that you can ask your question live and in the recording. So certainly feel free to do that. While we wait for this, then I have a question. You mentioned, and I think we've all seen this, that policies can be implemented. Sometimes they can be sort of vague in terms of exactly how they should be implemented, or even exactly what the purpose of the policy really is. What are some tips that you might have for how we can communicate with policymakers, assuming that sometimes we're not those policymakers, to help them to understand then what is measurable, what's not measurable, and what type of timeline we might be talking about? Because we can't have results right away, which is many times what happens. And then we do have a question in the chat that we'll get to in just this, in the question and answer that I'll read off next.
Yeah, I think there are two different aspects to the question you raised, Susan, right? One is that often the policymakers are not hardcore data people, right? And so just even the illustration of, let's think about how this is going to work. And it's easy, I think, once people engage in that thinking, oh, of course, teachers need to be trained, and then students will actually take the class. And then, so it's easier for people in that context to understand that, oh, this will take some time. But that's not necessarily their job to be thinking about it. It's maybe our job to help them think about it. And the other is, of course, articulating the goals. I think we want to do something, but how would we measure what we want to do? And the more we can say, I'd like to increase childcare participation by 5%, that helps us to get to policies that might be measurable.
And I think even with that example, then asking, well, what do you mean by participation? You know, is that people showing up? Is it the number of hours of service? Is it participating in certain types of activities, or, you know, different things like that? So no, I think you bring up a lot of good things. So we do have a comment in the question and answer, and it says, I think that the issue of text going into data is important. Very often a program will allow flexibility in doing something. A text field may be provided for what is being done, and it's not initially clear how to capture this with, say, specific fields. Do you have any thoughts on that?
Yeah, this is an interesting one, because on the one hand, I think our ability with natural language processing and other technical tools to make more of text and unstructured fields is expanding, and there's some temptation to think that the problem is going to be solved that way. But I think this goes back to a point that Susan, you had actually made to me earlier about the importance of communicating early with program implementers about what might be done with the data, and helping whoever's going to fill out that field to better understand the kinds of information that we would want to be seeing. They often have no idea, and we can try to convey what it is we would do with the data, and that might help them. I think we often in research practice partnerships find that that's what's helpful, is to help people understand, what are you going to do with it?
Yeah, I've seen that help a lot. I completely agree with that. And then also maybe even working with the people and organizations that are going to be affected by the policy to ask them what they think that it means. And that's a way also to get at some of the unintended consequences of a policy. Because as much as we might work with the policymakers for what they intend the policy to do, many times there can be unintended consequences that can be good or bad. You know, we don't necessarily know, but trying to dig up some of those things and make sure we're measuring some of those things. With the Older American Act programs, there's a requirement in congregate meals to allow for people that go to the congregate meals to provide monetary donations. But an unintended consequence of that has been that depending on how those monetary donations are asked for, it intimidates people, or they feel bad because they may not have the money to donate, and they stop coming to the meals, which is the exact opposite of the purpose of it. And so, finding out what some of those unintended consequences is can be good as well.
I'll make one point about the standardizing fields for data is the more innovative programs are and the more variation there is in implementation, sometimes our attempts to really nail down specifics miss the point.
Mm-hmm.
And so a combination of more structured fields and questions with a little bit of more open-ended, I think helps to balance, because I've seen in many situations, you've really nailed down, just tell us this, tell us what the income threshold is, tell us how many hours they can have. But if the implementation is quite innovative, they just can't shoehorn the main point into those little fields we've given them. So giving some flexibility in reporting can also help us get the big picture, I think.
That's a really good example. I hadn't even thought about that. But thank you again. We're coming up to the top of the hour. So thank you so much for your presentation. We don't have any questions in the chat or in the question and answer at this point. But I do want to thank you, and I want to let folks that are with us know that at the close of the webinar, and we'll close in just a moment, a pop-up, a survey for feedback should come up. So please give us your feedback about the series of trainings that we've done. If they're topics that you're interested in, anything like that, certainly let us know. The recording of this training and the slides will be available on the HHS Strategic Planning Resource Center. And so we really appreciate that. And just to give a little preview, our next training will be in June, on June 20th, evaluation, planning, and dissemination aligning with the federal budget process. And so we have someone from the Data Foundation who was instrumental in the committee that ultimately moved forward the Evidence Act. So we have Nick Hart joining us. And we have Demetra Nightingale, who is with the Urban Institute, but was also one of the leaders in terms of being an evaluation officer with the Department of Labor in making the Evidence Act a real thing. She had learning agendas before learning agendas were a thing, and did a lot of innovative work in the Department of Labor, which is a large decentralized agency, much like HHS. So I think you'll be really excited to see them. The link is in the chat. And so thank you so much, Rupa. We really appreciate you joining us. Thank you to the audience. And we're going to close out, and a survey should pop up. So thank you, everyone, and have a good rest of the day.